I am just going to see, there we go. I'm just giving this a click, Megan. Is that me clicking or you?
That's you. That's you. You got it. You're in control.
Awesome. Okay, so just to kind of, I realize on the call right now, there's probably people who are already using Plantiga, but there may be some new individuals who've never seen it or heard about it before. And I just want to give a little bit of like a 2-second overview of what it is. When I first got involved with Plantiga, Quinn Sandler, the CEO, called me. He knew I was doing research related to asymmetries in athletes with ACL injury. And the question was, hey, would you ever be interested in an insole that would do this? And the answer was absolutely yes, because that's the blind spot, I would say, is getting people assessed out in the real world. You know, it's great to measure them in the lab and to do stuff in clinic, but you know, you get people outside of that environment and it's nearly impossible. And then the other thing that I always would get a question, I would present to, you know, strength and conditioning coaches and practitioners and whatnot. And, you know, I would give this talk about the importance of measuring what matters and talking about some of the work that we're doing with neuromuscular testing and force plates and EMG and all that stuff. And of course, at the end of the presentation, someone would put up their hand and would say, hey, that's amazing. But listen, I don't have force plates. What can I do? And usually the answer would be like, well, unfortunately, not much, because, you know, that, you know, really no technology could bridge the gap. And so what's kind of cool about Plantiga is that it's, I don't want to say a force plate in your shoe, because we measure things completely differently. We're actually measuring movement and acceleration. So we're measuring the causes of forces, or the things that forces cause, right? How you move. But it's a very simple device that can be placed inside of a shoe or any type of footwear. And, you know, think about it like this biomechanical device that lives in your shoe and allows you to obtain all kinds of high-grade biomechanical data. And to do this in virtually any environment, whether you're in a clinic, a sport performance setting, out in the real world, you're wanting to do remote patient monitoring, which is a big use case. They're super thin. They're quite easy to use, and only getting better with our releases that are coming up in the first quarter of 2023. And at the end of the day, you know, you can get high-grade data that you can share with your clientele. I am going to press this once, because I think if I press it twice, Megan, sometimes I think it jumps because it takes a second. It's not changing, so why don't you change it? Could you? There you go, perfect.
You did it yourself, I didn't touch it.
Oh, weird. So it's like a 5-second delay at least between me pressing the button and somehow through the web, me controlling your screen. Amazing. So the goal is pretty simple, right? You know, we kind of view that this idea of measuring movement is one of the final gaps in the health stack in the wearable space. You know, you got wearables that are on your wrist. They can measure your heart rate, your steps, you know, your recovery, your sleep, your blood sugar. But it's kind of interesting that fundamental to all of this is our movement. It's exercise, it's physical activity. It's how we actually use our body on a daily basis that is so fundamental to achieving optimal health. Yet we know people get hurt when they move and they exercise. We know that sport injuries are rampant. You know, across the lifespan, we know that we're going to have illness and disease that might inflict us, but we want to stay moving and we want to keep that going throughout our entire lifespan, because that's how we achieve optimal health. But the issue here is that when it comes to movement, how do you measure movement at a granular level so that clinicians and practitioners can actually intervene, make a difference in your life? And the answer to that question is probably not overly well. A lot of biomechanical devices are either way too expensive or way too obtrusive, meaning you got to be in a lab, or it's like an Apple Watch, which, you know, I get it, can kind of track your steps and maybe how far you walked. But if you've got an Achilles tendinopathy or a neurodegenerative disease, it's certainly not going to allow your practitioners and clinicians to really get down to the level of granularity that you need to make differences in exercise prescription and rehab and all those things. So it's super simple. Our mission is to empower people to move better so that they can live longer, healthier, and happier lives. And we do this by establishing movement as the next vital sign. Just clicked there. And pregnant pause. So I got to time this. I think you got to do it. Oh, there. There we go. I'm just going to let you do it from now on, Megan. It's too slow on my end. Here's how we are, we've developed in the past year and a bit. We realized after building this technology in the sort of first part, which is, getting to the place where you have an instrumented insole, those two things are time synchronized. It can measure all the things that you want. You don't use data. That takes an inordinate amount of expertise and time. The next part in the journey is getting to know the end user. That is like the final customer, i.e. I'm a person who puts these in my shoes and I go for a run, and understanding like, what does that person need on their journey to support them? And we spent a good 18 months going direct to consumer, meeting as a sports science team on a weekly basis, looking through data, understanding the data, applying this in the real world, validating all of that. And I'll tell you right now that the key is that this technology is a conduit to connect people with people. So we connect practitioners to people, to the end user, and we allow and try to empower you to do a better job in terms of all the things that are entailed with helping your clients and your patients achieve progress in their movement health and movement quality over the lifespan. So key things that we're doing is we're breaking down movement barriers. This could be things like, hey, anywhere simple from like, what pair of shoes should I wear to optimize my gait when I'm starting off to run a marathon, to how do I deal with a Achilles tendinopathy that's keeping me from being active, to I've just suffered an ACL injury and I'm 16 years old and I don't want this to be the end of my soccer career. What can I do? All of these things are about breaking down those barriers that prevent us from actually being able to move and stay healthy and to keep on that track. So a big thing that we need to do with this technology is to promote that idea of prevention and early intervention, and the idea of education. The reason this is so paramount is that despite the fact that most practitioners and clinicians know they should be measuring, the evidence suggests that a high fraction actually don't do this. So you go to a clinic and you actually don't measure a single thing. It's purely based on feel, gut instinct, creating that relationship where we have return visits and return interactions with our patients and our clients, but we don't necessarily know that we're making things better other than just sort of the self-reported, like, I think I feel better or my pain's gone down. But here, now we've got this opportunity to measure, but you have to have that framework as a clinician or a practitioner to understand how to use these data to help make informed decisions. And that's that whole education arm of what we're trying to achieve. Megan, do you mind popping to the next slide? So with that, I just want to drop into our second goal of the presentation here this afternoon to talk about how this is currently being used in the clinic. I'm then going to throw over to Megan after that. But Megan, let's click on to the next slide, and I'll just quickly talk about what this is sort of about, sort of adopting technology into the clinic. My experience talking to clinicians and practitioners is that a big barrier to using technology in the real world is time and having usable data, meaning you get stuff, but you don't necessarily know what it means. You don't necessarily know how to action on it. And really at the end of the day, it's like using data informed versus replacing decision-making with data. And so I guess what we're trying to achieve here is this whole idea of helping you to adopt this technology into your practice and really helping you to get from sort of an early user of the product, i.e. you're like, I'm curious about this and I want to use it. And we're trying to bridge the gap between where you enter into Plantiga and where our power users end up. And I will tell you right now that our power users have fully integrated Plantiga into their workflows in the clinic environment. They are testing 10s, 20 patients a day, providing reports, monetizing this, meaning they're providing this as a service to their clientele. Their clients are coming in asking for Plantiga assessments. So it's really now, you can imagine, emerged into their fabric of how they operate and how they earn their revenue. And that's kind of the goal, getting you from sort of that entry point where I just got this in my hands and I got to figure out what to do, to this point where it's now fully part of your day-to-day habits as a clinician or a practitioner. So what we are seeing in terms of a workflow about how this has worked best is this idea of pre-appointment testing. So, I'm a patient, I show up to a clinic, I've got a sore knee. I've been working with my physiotherapist or my physical therapist, depending upon where you are, to bridge the gap. I show up, I have a kinesiologist who sets these up in my shoe and allows me to either do a run test, a walk test, or a jump test. This allows us to have some gathering of data, which the kinesiologist can instantly upload onto the web, which then allows me, when I go in to actually sit down with my caregiver, to be able to review my data and to understand how I'm progressing inside the goals of what I've established, whether that's return to sport, return to activity, dealing with pain, or simply just trying to manage a lifelong chronic disease. From there, the whole goal is to calibrate the rehabilitation program. So the idea here is, how do we look at the data and make some decisions around, okay, we think that we're going green light, all systems go, you're heading in the right direction, maybe an amber light where we need to make some changes or reestablish what the goals are or the progression. And then the other part would be a red light, which could be, hey, we need to stop and take a full reevaluation of what we're doing to understand what's missing so that we can move this person forward. In this vein, the great thing about Plantiga is it really does allow for retesting and long-term monitoring. So like I said, this now becomes a fabric of that return, sort of like return on the investment on the behalf of patients, the value proposition in terms of how we create that long-term relationship. We're even seeing in the case of return to sport after ACL injury that a lot of our clinicians, where normally they would have graduated that person on to, let's say, soccer at 6 months post-surgery and said, hey, best of luck, we hope it goes well, we'll see how you do. They're able to create this long-standing relationship over many months and even a couple of years after that injury to be able to sort of have that ongoing, are we progressing towards the goal or regressing? So with that, I'm going to throw over to Megan. Megan's going to talk a little bit about some of the work that we're doing with special populations, because my area being musculoskeletal injury and athletic performance is just one branch of where Plantiga has been very successful for clinicians and practitioners. And as you're going to see in the next little bit, Megan's going to show how we're using this as well in other populations to get some profound results. So Megan, I'll throw over to you.
Thanks, Matt. Yeah, special populations, it is a topic that I hold pretty closely to me. This is something that I've been teaching courses on for a bit and developing content for. And sometimes we think of special populations, we kind of like default think of like disability, but it really simply means someone with a special consideration when it comes to how we are designing an intervention approach and how we are assessing them and how we are interpreting their movement. And that can range from, you know, the neuro patient to the PD patient with or any other type of movement disorder to the injured athlete. It can be long-term and chronic. It could be, you know, stable. It could be progressive. It could be a temporary state. And these are all things that clinicians are, you know, and practitioners are very, very familiar with. This is where the majority of their clientele are coming from. And when it comes to special populations and needing those special considerations, this is where patient-centered care is really critical. And what I'm going to be doing in the next slide is kind of looking at examples of how we could be adopting more precise data acquisition and assessing these types of individuals from three different use cases, MSK, neuro, and return to sport, in order to understand more of why the person moves the way they do. If we understand the why, then we can create the more specialized intervention approaches. So special pops, special considerations. And going back with like my biomechanics background, it always makes me think of the degrees of freedom problem. And even with our discussions, Matt, talking about, you know, single leg hop and how, you know, we are prioritizing outcomes over strategies, and how the degrees of freedom problem, there's so many different combinations of muscle contributions and timings, joint rotations that can allow us to achieve the goal of the task. So if the goal of the task is jumping high, someone with a different strength and someone with a different weakness, someone with a different injury history, they can achieve that goal very differently. So something that we've also been really trying to prioritize with our reporting and allowing practitioners to use our metrics to create these very individualized intervention approaches is identifying strategies. So the first one with musculoskeletal injury, this is an opportunity, or Plantiga provides an opportunity to look at asymmetries in a level of granularity that, you know, practitioners weren't able to do before. And even though we do believe that, you know, asymmetry is just one piece of the puzzle, we need to look at overall performance. And like we always requote Matt, that I'd rather be a little asymmetrical and strong rather than symmetrical and weak. And I speak to that. I've been in that stage of highly detrained in my life after having my daughter. And I was super symmetrical, but I did not feel good. So it is a gap, though, that has been really difficult to quantify before for practitioners. And it's a unique opportunity that Plantiga can fill for them. And to bring it back to the shifting from, you know, prioritizing and hyper-focusing on outcomes, or especially with jump testing and even GAIT, it's like, you know, if we want to look at the mechanism, we need to look at the different events of the movement itself. So for example, this is an asymmetry plot from one of our reports, looking at load asymmetry, ground contact time, leg swing time asymmetry, landing vertical acceleration asymmetry, and takeoff. So we're looking at not only how the foot is moving in space during leg swing, and also how it is interacting with the ground upon toe off, as well as initial loading. So if we want to be supporting practitioners in a way, like Matt was saying, yeah, it's great that, you know, we can create these metrics, but there's also that, like, what can we do with them? So this is where the ability to quantify the level of functional deficit after injury becomes very important. And the ability to really look at mechanisms, right? In order to monitor someone over the long term, and we're looking at how asymmetries change over time, how outcomes change over time. Why is it that some patients benefit from an intervention approach while others don't? Why is it that some individuals get re-injured? Why is it that others don't? Or why is it that some individuals, especially with ACL injury, they injure their other side? We have this big gap in looking at what is the mechanism for these injuries. And there's also the discerning between what is the mechanism of injury and what is currently the strategy because of the pain and the injury itself. So being able to get such high level of granularity in these details, especially with asymmetries, again, asymmetries is one piece of the puzzle, and it has to be combined with other interpretations of overall performance as well. But knowing these precise events, if I see that there's an asymmetry in my, you know, Matt showed in the last webinar about with his Achilles tendinopathy issues, where it was really affecting his vertical takeoff acceleration asymmetry. So it was much lower on one side. So if we're in the clinic and we see that, okay, yes, there's a little bit maybe of a limp. Okay, how can I quantify that? That's one thing. But sometimes movement may look fine. And when you watch someone, it may look, you know, like there's something off. But if we're only quantifying, for example, how long it took someone to walk, you know, a meter, or how long or how far someone jumped, we're not looking at the contributions to that performance and the strategies that contributed to it. And if there's a deficit, where is that deficit coming from? If we know that where that deficit is and that weakness is, then we know exactly what area we need to be targeting for the intervention. For neuro, we've been developing reports that are focusing more on balance and movement control. So you can see that this is an example of the double support plot and our leg swing time variability. And it's being able to also identify to practitioners that where they are in the good versus bad, right? So, you know, we go to school and we learn, you know, the criteria and the cutoffs, and we memorize them. But sometimes, you know, we can't really, you know, memorize everything. So it's like, great, now I can have a technology and I can measure and I get these numbers. But then a lot of practitioners with adopting technology in their clinic, they get to that roadblock of like, you know, okay, what does that number actually mean? So with that and how we're wanting to do more and support, and basically, we're wanting to make the practitioner's job easier so that they can help their patients, they can monitor them, they can understand disease progression more effectively with neural populations such as Parkinson's or stroke. We want to be able to look at and see if there's any of those red flags in predicting fall risk, which is a major health system drainer. Medication effectiveness. This is an area that, especially with Parkinson's, that really is difficult to monitor with only clinic visits, right? Whether they're on their medication or off their medication, how effective it is. If we're able to monitor these neural patients that are at high risk of falling, in their element, not in the clinic, then we can get a greater lens on how they move in their environment, how their environment is different and how it may be increasing their risk of falling. And that is that key component to prevention. Then the third example is return to sport. And so what I'm demonstrating here is a simple single leg jump RSI test. And Matt, I'll let you speak a little bit to the RSI and kind of like lead into the scenario here. But what we're seeing with this particular athlete is pre-practice, post-practice, they are fatigued. And yes, we would expect that, if they're fatigued and after their practice, this is after an ACL reconstruction, that, yeah, okay, I would expect that my RSI performance or my jump height would decrease. But what's interesting about this case is by looking at the different components, so jump height, reactive strength index between the limbs, we can see that there's a complete shift in the strategy, right? So where the jump height on the left affected side, it was lower with fatigue, the actual reactive strength index was higher, right? So where the complete opposite we were seeing with the right unaffected side. And these are the things that are kind of like, over the past few months of past year working with Plantiga, it's like all of these aha moments. And we always kind of have those inklings in the back of our mind of like, oh, it could be this could be a mechanism, but we never had the tools to support this. And we never had the tools to be able to monitor these athletes in their environment where it happens, right? We can look at an athlete after surgery and they look great. They're hitting those criterion standards. They're hitting, the 90% symmetry or higher maybe. But then you look at them like post-practice or, post-training, and they don't have the capacity that they used to have. But it's the practitioner, they can't be everywhere. So with monitoring, especially has strong applications in return to sport. I don't know if you want to add to that, Matt.
Yeah, I mean, I'll just keep it really brief. I just think that it's an example, Megan, of how Plantiga is sort of evolving with the current literature in this, as an example in this domain. I mean, that's something that's sort of been coming out more frequently in the literature, and I talk about it quite a bit, is, the original issue is that after an ACL injury, most people don't measure, they just use time. So, just be like, well, it's been 9 months and your knee feels stable. There's no reason why you shouldn't try coming back. And I often hear that the recommendation would be something like, well, just, give it a go. Don't start too hard. Try to kind of ease yourself back into it, and we'll see how you do. And hopefully, everything goes well. Now we all know how that story ends, right? With time as our criteria, we know that at 9 months, you may look like you're 5 months. The greatest risk for re-injury is a couple of years down the road. All of these other factors come into play. So we know that that's suboptimal. The second issue is that the other standard of care, which is hops for distance, it's becoming increasingly clear that sure, it might be good at sort of detecting in people who are very deficient, if they've got sort of a limb symmetry issue or something grossly, from a neuromuscular standpoint, things that are happening. But athletes can eventually figure out how to achieve symmetrical horizontal jump performance by using the hip, using the ankle, and compensating. And so we know symmetry is not really a great measure, especially when it doesn't really tax your knee joint. So you move it all the way down to the year 2021, when a large-scale study examined the predictors of re-injury in a large group of level 1 athletes and found that most of our conventional measures for rehabilitation were not overly sensitive to the thing that we care about, which is staying healthy and not getting hurt again. Interestingly, one of the metrics that was predictive was this idea of reactive strength. So this is where we take a ratio of jump height to the jump contraction time. We can examine it in long duration stretch, shorten cycle movements like counter movement jump, or in fast things like hopping. And we can use this to really determine after an ACL injury whether or not somebody looks like a nice stiff suspension Audi S4 or a squishy Cadillac. And really at the end of the day, that's sort of what I think we're showing here and showcasing is you got a tool that allows you to achieve some of the most current tests that are being promoted in the literature, but doing this with a wearable technology and doing it in a way that could be in replace of things like force plates or high grade biomechanical testing in environments where that can be challenging.
Yeah, especially with their time is the essence of if you want to see how fatigue is affecting them. You want to be measuring them right on the field as soon as they're done, not the next day. You need to be measuring, as we say, like where it matters and when it matters. And I love the anecdotal comment of where you were pre-injury is what got you injured, right? And we're hyper focusing on getting to comparable of what the other limb was, rather than maybe some other objective measure. And the idea that if we're using the kind of like gold standard approaches determining if an athlete is ready, we're forgetting the fact that different sports have different demands, and then like different positions in that sport have different demands. If I have, a basketball player that is always using their left leg to plant and really generate that energy to do that layup, then they're chronically loading up that left side. I feel in my gut that it would be better for that basketball player to have a little bit of a left-sided symmetry when it comes to maybe like a jump performance metric. So though that individualized approach is something that we are very, very passionate about in comparing you against you, but also letting practitioners know that whether they are within those kind of like, those population norms. So to finish off the seminar, I just want to discuss and touch on some potential opportunities of using and integrating Plantiga in the clinic. And it's really, I worked in clinics, I worked in physio clinics, I've worked in research labs in, hospitals, rehab hospitals. I worked in labs. I'm collecting, data on different participants of different special populations. And the common thing, and it even will go beyond that with not even just like clinics, it is even sports teams, athletic therapists, strength and conditioning coaches. They all have this ceiling on them of time. They can only do so much, and they can only be where they can be. They can't be everywhere at once. And their time is that really strong limiting factor, as Matt had touched on beforehand, that if you can't either, increase the number of hours in a day or just like work more hours of the day and burn yourself out, you have to be able to do more with that time. And so I'm going to give a couple examples of how we can help practitioners do this with integrating the system in their workflow. So the first one, with informed decision-making fueled by relevant information, it is essential to making the right intervention, decisions with the rehab, but it's also a way to help standardize the flow of operations in a clinic. So we're making sure that all the clinic activities are running like a fine-tuned machine, and that all of your resources are being allocated in the right way, so that we're being efficient, and it's going to be enhancing and driving your business strategy to be able to give more value to the patients there. The next part is reach, and we've touched on remote monitoring and the value of that. And it's the same thing, that you can't be everywhere. You want to help your patients. You want to help them, in the real world, you want them to succeed. But once they step out those clinic doors, you're at a major disadvantage. I don't know how many times, like even myself, whether it is, to a physio, massage, even going to a hairdresser or something like that. You walk out the door and you're like, yeah, I really like that. But as soon as you walk out, your likelihood of actually returning, unless it wasn't, a really great experience, is significantly reduced. And so remote monitoring is one way to stay connected with patients and get them to come back, and get them to stay invested in your clinic. And then it's also being able to see even, because we now have the capabilities with the Plantiga app, where they can see their performance metrics at any time. They can access them. And then also that you can monitor them anywhere. So you're able to reach patients, individuals outside the clinic doors. And that is also opportunities to be able to, if your clinic really wanted to expand and work with like teams or, have collaborations with different groups. And this is a way that you can reach people outside those clinic doors. And that also leads into churn, right? Churn is like, the business's worst enemy. And there's always some level of churn, but the more patients and clients that you lose, the more you have to invest in marketing, and the cost of acquisition of customers like skyrockets, because for everyone you lose, you're trying to replace them just in order to stay, where you are. And that is a big roadblock in being able to grow and scale as a business. So being able to educate, engage, and reach them outside those clinic doors, and so not having to pause once they do walk out in your way of being able to support them in their rehab journey, does lead to favorable improvements in business retention. So instant feedback even on their movement quality. So if you get them to do a walk test and, within a matter of minutes, you are able to see their GAIT metrics and show it to them, that instant feedback is really critical to knowledge transfer and getting them to engage with their rehab journey. Also making it fun, as we're kind of touched on in the previous webinar, we hear from practitioners that are using the system. The patients are like, oh, look at my ground contact times this day. Like, look how much that asymmetry reduced. And it's being a fun and way of kind of like you against you in your movement health journey. And also, it all comes down to trust and loyalty with objective data. The biggest, roadblock when you have someone like, movement experts, practitioners, clinicians, you have this large experience, expansive experience in investing in your education, your eye for movement strategies, and being able to detect very small details in GAIT metrics, or you watch someone walk and it makes sense to you in your head just by watching them that something's off or something looks good. But for the patient, and you're really wanting them to invest in you and trust you, and in order to come off as very authentic and true, it's really tough to transfer this knowledge, or get them convinced and understand the importance of it and believe you if they don't have the similar type of background. So being able to show the changes, being able to show the metrics, and the ability for like a patient that in themselves, they know that something's a little different, and they know that things feel better, or they know that things feel worse. Having an instant report with collecting these assessment, the data from the assessments, really validates their experience to them in their rehab journey. And this is that key underlying foundation to retention, that trust, the loyalty, and then making them become advocates for your business as well. The next one, all this together, scaling. Like I said, time is your limiting factor. So you either have to do more in a limited amount of time, or you have to be able to charge more per hour, like in that time. So Matt showed the way of integrating testing in the pre appointment. So you're able to test, monitor in minutes. You're able to generate reporting in minutes. You're able to give it to them right away. And if you are going to be charging them for premium testing and services, you're able to charge more in that amount of time. So these are the ways that we can help those practitioners standardize, make it efficient, reach more patients, do more in their already limited amount of time, and increase revenues. And then finally, the key everyone talks about, you got to differentiate, you got to stand apart. Physio clinics and even strength and conditioning businesses, it is highly saturated market, highly saturated, highly competitive, and everyone's trying to stand apart. And the big problem is that sometimes when people try to stand out, they try to be different, but they forget what the foundations are in being able to help their patients, help their clients. So in this saturated market and being able to differentiate, stand out, acquiring or integrating quantitative data assessments, collecting, visualizing, communicating their movement vitals effectively, more easily, doing it very quickly. It does provide more value to the patients, and providing patient value is your big differentiator. And there's different ways of doing that, but something that has been a really big eye-opener to me when it comes to business strategy and learning more about it is that customer satisfaction is based on whether or not you exceeded their expectations. And so you can literally do the bare minimum, but as long as you exceeded their expectations of what they thought they were going to get, they will be more satisfied versus if they went to another clinic and they had these very high expectations and their expectations of how their visit were met. So it is something that we need to be thinking about of how we're able to increase customer satisfaction and improving the customer experience there. And being able to differentiate with reporting and providing something that their competitors don't is great. Being able to provide something that actually means something to them is even better. So it's like you go to the clinic, a lot of you, we can relate to this. You have your resource sheets, and then as Matt said, it's kind of like, all right, you're bye, like I'll see you in your next appointment. But this is definitely a way of providing a different value added service that competitors wouldn't be able to. And then using reporting, if we want to be able to really show that you are an expert in what you do and you have this high level expertise to get your patients to trust you, get your patients to really invest in you and get them to invest in their intervention, their rehab strategy, and understanding the importance of it for their movement health, reporting supports that. Reporting allows you to communicate more effectively and really demonstrate that you are the expert, and the ability of that value they can get from the differentiation. And then there's also that, like being able to say this is something, a cool technology that professionals use. And every average Joe, they hear that, like, their favorite NHL star, their NBA star uses this technology, they will be probably searching for you, coming to your doors. So that kind of kicks things off, or ties everything up together of how we can start looking at how Plantiga can be integrated in the clinic. The next webinar will be focusing on actual case studies, and we're really excited to show you guys that on actual proof of concept, proof of changes, and how it looks like with our trends and our analytics and our reporting. So Matt, I'll if you have a couple more things to tie things up and comments to make before we move on to the Q&A, feel free.
Yeah, thanks, Megan. No, great job. I think you're definitely, you did a good job of just sort of creating I guess maybe the vision of how technology is emerging in the field and ways that we can use this more effectively. So not much more to add. I'm just looking at the time. We're about 45 minutes in. We try to keep these short. Maybe what we'll do is we'll just pause, see if there's any questions. And I'll also say that if there aren't any questions on the webinar, I've had a couple people that I've responded to directly via the chat. But don't be afraid to reach out to us through our platform, our website, and we're happy to chat. So let's pause there, see if there's any questions.